Imagine taking in the fresh air while trekking through the woods on a beautiful afternoon, totally oblivious to the fact that a little tick has already attached itself to your flesh. Although most people consider ticks to be bothersome pests, one variety of tick carries a virus called Powassan that can kill you with just one bite. Powassan can spread in as little as 15 minutes, silently penetrating your brain and neurological system, in contrast to Lyme disease, which progresses gradually over days. The infection can progress to confusion, seizures, paralysis, or even coma in a matter of days. Although the initial symptoms are frequently subtle and deceptive, such as a little temperature, headache, or weariness. Powassan is particularly dreadful because there is no vaccine, no particular antiviral therapy, and even survivors may suffer irreversible brain damage. The likelihood of coming into contact with this unseen danger is rising as ticks proliferate as a result of human activities and climate change. We'll examine the Powassan virus in this video, including how it spreads, why it's so dangerous, and what you can do to keep yourself and your loved ones safe. When it comes to one of nature's most deadly concealed killers, even a few minutes of attention might mean the difference between life and death. Let's watch. One of the deadliest viruses spread by ticks is Powassan, mostly present in the northeastern United States, the Great Lakes region, and portions of Canada. The Powassan virus is an uncommon but potentially fatal virus spread by ticks. The Powassan virus is significantly less prevalent but far more severe than Lyme disease, which is well known. About 10% of Powassan infections result in death, according to experts, while almost 50% cause long-term neurological issues like paralysis, memory loss, or trouble speaking. The virus is conveyed by the black-legged or deer tick, Ixodes scapularis, which is also responsible for Lyme disease. There is extremely little time for early prevention once a tick has attached, since Powassan can spread within 15 minutes of a single bite, in contrast to many other tick-borne illnesses. Awareness and prevention are crucial since many people are unaware that they are sick until serious issues arise because symptoms can take days to manifest. 2. The brain and spinal cord are attacked by the virus. As a neuroinvasive virus, Powassan attacks the brain and spinal cord as well as other parts of the central nervous system. Once inside the body, it can lead to meningitis, which is an inflammation of the protective layers around the brain and spinal cord, or encephalitis, which is an infection of the brain. Seizures, excruciating headaches, disorientation, nausea, and even coma can result from these disorders. Survivors frequently experience persistent neurological impairments that can impact speech, movement, and cognitive function. Medical treatments concentrate on supportive care rather than infection cure because the virus targets nerve tissue directly. Early detection and prevention are crucial because there are currently no approved specific antiviral treatments for the Powassan virus. The virus is particularly hazardous among tick-borne diseases because of how quickly and severely it can infiltrate the nerve system. 3. Initially mild symptoms can quickly worsen. Early signs of an infection with the Powassan virus might be misleading. Mild fever, headache, nausea, or exhaustion are common symptoms that are simple to write off as the flu or a seasonal infection. Nevertheless, the infection can worsen significantly in a matter of days, resulting in disorientation, trouble speaking, seizures, and memory loss. Powassan's neuroinvasive effects can appear within a week of the bite, giving patients very little time to seek urgent care, in contrast to Lyme disease, which can take weeks to manifest symptoms. Despite being admitted to the hospital, some individuals develop a coma or suffer irreversible brain injury. People may not even be aware that they have been infected until the sickness is well advanced due to the virus's ability to spread silently and the vagueness of the early symptoms. This emphasizes the significance of tick prevention and prompt medical attention following any tick bite. 4. Powassan can be spread by ticks. Very fast. The Powassan virus's quick spread is among its most concerning features. A human can become infected with Powassan in as little as 15 minutes, but Lyme disease usually takes 24 to 48 hours for a tick to attach and spread. Because of this quick spread, it's crucial to look for and remove ticks as soon as possible, especially for anyone spending time in grassy or forested regions where ticks are common. The main carriers, deer ticks, are small, often smaller than a sesame seed, and so simple to overlook. Vigilance is crucial since ticks adhere directly to skin or clothing, unlike mosquitoes, which can be prevented with nets or repellent in public places. Risk can be considerably decreased by donning long sleeves, tucking pants into socks, and using insect repellents with DEET or clothing coated with permethrin. The first line of protection against one of nature's most deadly microscopic threats is a knowledge of tick habitats and behavior. 5. While rare, outbreaks are becoming more frequent, with just about 200 cases reported in the U.S. since its discovery in 1958, the Powassan virus is still regarded as uncommon. However, the number of recorded cases has significantly increased in recent years, most likely as a result of human expansion into woodland regions and growing tick populations. Longer summers and warmer winters make it easier for ticks to live and procreate, which raises the risk of human exposure. Better diagnostic testing and greater awareness have also raised the frequency of detection, while many mild instances may still go undetected. Even while outbreaks are small and restricted, the severity of the infection implies that even one case can have disastrous effects. To lower the risk of serious infections, public health professionals place a strong emphasis on education, surveillance, and prevention in high-risk locations. 6. No specific treatment or vaccine exists. There isn't an approved vaccine or antiviral medication for the Powassan virus at the moment. After an infection, the main focus of care is supportive hospitalization, may involve IV fluids, respiratory support, drugs to lessen brain swelling, and seizure control. It may take weeks or months for individuals to recover, and some may sustain irreversible brain damage. Because of how quickly the virus spreads, prevention is thought to be significantly more successful than treatment. Important tactics include preventing tick bites, checking for ticks frequently, and eliminating ticks as soon as possible. In high-risk locations, public health programs often emphasize awareness, teaching locals and outdoor enthusiasts about tick exposure, reduction strategies such as wearing safe clothing, using repellent, and changing the landscape. 7. Easy actions can prevent infection and save lives. Despite the Powassan virus's rarity, prevention is imperative because to its severity. Ticks prefer tall grass and dense underbrush, so those who spend time outside should wear protective gear, apply repellents, and stay away from these areas. You may significantly lower risk by checking for ticks on your children, pets, and yourself every day. It is important to keep in mind that Powassan can spread fairly instantly, but prompt removal of connected ticks can stop the spread of other infections. Tick presence can be decreased by landscaping modifications, such brush removal, leaf litter removal, and erecting barriers between dwellings and wooded areas. Your best defenses are awareness, alertness, and quick action following possible exposure. Understanding the hazard and taking preventative measures to keep safe are more important than being afraid in order to protect yourself and your family from the Powassan virus. Outro. Despite being uncommon, the Powassan virus is unquestionably dangerous. It is one of the most deadly viruses spread by ticks and can cause severe brain inflammation, convulsions, and long-term neurological damage in just a few hours after a tick bite. The importance of prevention is further highlighted by the lack of a vaccination or targeted treatment. Your best tools are awareness and alertness. You may significantly lower your risk by wearing protective gear, using repellents, checking yourself, your kids, and your pets after spending time outside, and making minor adjustments to your surroundings. This invisible threat could spread with even a small slip-up in prudence. Even though the majority of ticks are benign, Powassan's presence serves as a reminder that even the tiniest insects can harbor fatal surprises. Don't undervalue the danger or think you won't experience it. It is crucial to have knowledge, be prepared, and act quickly following exposure. You can shield yourself and your loved ones against a virus that spreads quickly and causes terrible damage in its wake by taking these precautions carefully. Keep in mind that even the tiniest bite can pose the greatest threat, but you can maintain control and safety by being vigilant. Let us know in the comments what you think about this tick bite could kill you inside the Powassan virus, and don't forget to like, subscribe, and stay tuned for more captivating content on our YouTube channel.